If a survey were conducted among the population to determine the most common causes of death, people would likely mention oncology, think about cardiovascular diseases, and, of course, discuss complications from viral infections. Very few, however, would recall thrombosis, even though the formation of blood clots ranks high in mortality statistics. Strokes and heart attacks, pulmonary embolisms, these are swift and lethal consequences of blood clots. The peculiar thing about thrombosis is that it often occurs without symptoms. While the clot forms, adheres to the vessel wall, veins, or arteries, and grows. In 59% of cases, it causes almost no apparent symptoms. Or rather, there are symptoms, but they are often vague and transient, making them difficult to notice. However, when the clot detaches and blocks an artery, complications occur rapidly. The clot simply detaches from the vessel wall, travels through the bloodstream, and obstructs a pulmonary artery, causing the person to stop breathing. Two questions immediately arise. What is a thrombus, and how can you tell if you have one? A thrombus is a blood clot. Our blood has the ability to clot, which is normal and even beneficial. Without this ability, a person would lose too much blood in any injury or cut. When blood clots, it forms a protective scab. Platelets, non-nuclear repair cells, are responsible for this clotting process. There's also another system, the anticoagulant system, which includes antithrombin 3. Sometimes, the balance between these two systems is disrupted. Platelets start to stick together not where protection is needed, but inside arteries, veins, and even in the chambers of the heart. Very often, platelets seem to arrive at the right place. The vessel wall is damaged, and this can happen at any time due to factors like smoking, high sugar levels, blood pressure spikes, a sedentary lifestyle, and excess cholesterol. Platelets come to repair the vessel but sometimes overdo it, resulting in a clot forming on the vessel wall. That's a thrombus. Now, it has three potential paths: to grow, obstructing blood flow; to break off and cause an obstruction; to dissolve. For the situation with a thrombus to follow the third, most favorable scenario, it's essential to quickly determine if you have this thrombus or maybe even more than one. It is estimated that 1 in every 4 people on Earth is at risk of thrombosis. Moreover, a thrombus can form in virtually any part of the body because blood vessels permeate the entire organism. Depending on where the thrombus forms, whether in veins or arteries, the symptoms will differ. What should alert you if a thrombus has formed in an artery? Cooling of the limb. Blood carries energy and warmth. When a thrombus partially obstructs an artery, the limb receives insufficient blood flow. Typically, fingers or toes, palms and soles, which are farthest from the heart, become colder. If you notice, for example, that one leg is noticeably colder than the other, it's worth considering that a thrombus may have formed in that leg. Paleness of the skin. This symptom is quite straightforward. When blood circulates actively, the skin becomes rosy and flush. This is especially noticeable in areas where capillaries are close to the surface. When blood flow is disrupted, the skin becomes paler. Weak pulse and blood pressure fluctuations. If you measure blood pressure on both arms and it differs significantly, it's another sign of an arterial thrombus. Intermittent limping, numbness, or tingling in the limbs. Restricted mobility of the arms or legs. Each of these symptoms can be explained by disrupted blood circulation, and this is no exception. Swelling, skin darkening, peeling, or, in the worst cases, necrosis. Such symptoms appear extremely rarely in prolonged thrombosis. However, much more often, clots form not in arteries but in veins. In the case of deep vein thrombosis, blood clots accumulate in the veins of the calf or thigh. Clots in the veins of the upper limbs are much less common. It's not difficult to determine that a clot has formed in a vein. The following symptoms may indicate it. Frequent leg swelling. This condition is usually associated with sitting uncomfortably, compressing the leg. But if the leg starts to swell without a clear reason, suspect thrombosis. Redness of the skin on the legs near the suspected thrombus site. The vein expands, causing small blood vessels around it to fill with blood, resulting in skin redness. In advanced cases, the skin in that area may turn bluish due to decreased oxygen levels in the blood. Sometimes nodules and lumps can form on the leg, resembling varicose veins. However, where there's varicose veins, there's a higher risk of clots, soft and asymmetrical swelling of the limbs. Due to the clot, the leg swells and becomes visibly bulkier. If you press on the leg, you'll feel a slight indentation, and then the swelling returns. Dull pain in the leg. This pain doesn't worsen with movement. You just constantly feel a persistent, dull ache, which can even trouble you during sleep. And if a thrombus formed in your leg or arm detaches from the vessel wall and travels through an artery to your lungs, it leads to a life-threatening condition called pulmonary embolism. This condition is fatal in 70% of cases, so it is crucial to react quickly and call for emergency help. When the lungs are blocked, sudden and severe shortness of breath, chest pain, and increased heart rate occur. All of this may be accompanied by coughing up blood and breathing difficulties. These symptoms are very similar to a heart attack, and the diagnosis of pulmonary embolism is made after ruling out a heart attack. The unique aspect is that the thrombus detaches suddenly, often without any prior warning. The only correct treatment for pulmonary embolism is medication and surgery. If you experience these symptoms, it's essential to see a doctor. Even if it turns out not to be a thrombosis, such manifestations are clearly not safe for your health. Thrombosis is quite common, with 1 in every 4 individuals having the potential to develop a blood clot. However, you can avoid being part of the statistic by understanding the risk factors. Those most susceptible to thrombosis are individuals over 65 due to the condition of their blood vessels. Prolonged periods of immobility during long journeys, sitting or standing for extended periods, contribute to the formation of clots. A sedentary lifestyle often leads to obesity, another risk factor. Smoking, which causes blood vessel spasms, and oncology can worsen the situation. However, a healthy lifestyle doesn't always guarantee protection from thrombosis. Unfortunately, this condition often has a genetic predisposition. If your parents, grandparents, or great-grandparents suffered from blood clots, you may also have a high risk of thrombosis. So, it's essential for everyone to be aware of the signs of thrombus formation. If you experience these symptoms, consult a doctor for evaluation.